In the year 2010, Kenya promulgated a new constitution and with it, devolution. But 11 years later, the state of mental health services in the country is in a sorry state, marked by a few, if any, standalone mental health facilities in the counties. My name is Dr. Mercy Korir, and on this episode of Health Digest, Chebet Birir takes a tour of coastal Kenya and brings you this story on why we need to invest more in our mental health services.
On the 13th of October 2021, we traveled to Kilifi County. We meet Liz Kaschana, whose troubles started after she fell in love with a man who later left her for another woman.
At a very tender age, I was a junior project manager mahali. I was doing my bills comfortably. I have a kid that I would make sure I'm fanya all basics, at a leisure needs.
After she met this man who would provide anything and everything she needed, she left her job and went to be with the man of her dreams, a decision which, according to her, felt so right at that time. But no sooner had she settled in with her mother-in-law than strict rules and regulations became part and parcel of the long-distance marriage.
Yani anytime alikuwa yojua niko wapi, nafanya nini.
Kwa mnaishi na yeye lakini.
Yeye alikuwa anaishi ako abroad. So nafikiri huko abroad aka-abroadiana. Waka-abroidishana na mwenzake. Vitu zika-abroidika. Sasa, mimi nikakuwa the other chick. Inquiries, hakuna kitu sensitive unaambiwa. Oya buda, kuna hivi na hivi na hivi nafanyika azi nini. Basi siku moja tu vitu zikalipuka. Nafikiri alikuwa anachoka kukua under the cover or something. So vitu zile nilipukia ni as in vitu zile zilipuka, realization yangu ilikuwa like what, like yo, like really maze sacrifice yote maze 2 years mimi nilikuwa slay queen but nikaenda shamba. Nikalima my friends, nikasimamia mijengo zenye unalia nini? Hey, kasimamia mijengo zenye hata sitaziishi my brother.
The discovery of this affair led Kaschana into depression, even to a point where she had suicidal thoughts. She didn't know where or whom to turn to.
As going through affairs in life, sasa watu wa kuongea nao ikawa ni adimu kidogo. Nikawa nimebase sana kwa social media, ilikuwa inaniamsha na kunipa usingizi. Nilikuwa nasikiza muziki sana, Facebook and all that stuff.
It is during one of these nights scrolling through social media that she found the solution to her problems.
Siku moja nilikuwa naangalia Facebook, nikapatana na watu na share stories zao ambazo zinalingana kidogo na zangu japokuwa matukio ni tofauti. Sasa nikaona kitu inajiita Hands of Hope Initiative. Kuna msichana ameweka profile yake vizuri hapo, mrembo, miaka kidogo tunaendana, hata nafikiri tuna miaka kidogo same. Nilikuwa nimejaribu kuzungumza na marafiki zangu wa karibu sana, kwa hivyo kuzungumza na mtu anonymous ikawa ni option ambayo sikutaka sana kuzungumza na watu ambao wananijua because watu walikuwa wananiangalia like huyu kasichana naye.
Fanis Amuhale is one of the very few individuals who have taken the initiative to start a community-based organization in Kilifi to help curb the rising cases of ill mental health in the county.
being someone who's been raised in Kilifi, it's something that I can champion, especially when the cases of suicidality were rising and mental illness. I saw that it's good that I take up this initiative and do it voluntarily, and it's something that I really thank God because people have embraced it, and at least now the people view mental illness at a different perspective. And through the sensitization and community awareness that we've been doing, we've been able to reach out to those who have this illness so that they can know that they're not alone. They have people who can walk with them through this journey.
There is no standalone mental facility in Kilifi. The nearest referral hospital is Port Reitz in Mombasa, which is about 70 kilometers away. This is about a 2-hour drive. Port Reitz serves all the 6 counties in the coastal region: Kilifi, Kwale, Lamu, Mombasa, Taita Taveta, and Tana River, and sometimes other counties beyond this. Even though they try their best to attend to the patients, the staff are strained and the facility lacks adequate funds.
In terms of staff, we are very few. Like you see, our capacity, bed capacity first is 72, but sometimes we even overbook the patients because you find patients, there is no any other mental hospital around the coast. Port Reitz is the only one. So like currently we have 81 patients, and having 2 counselors is a very big challenge. Having 4 occupational therapists, it's also a challenge with the nurses. So we are really understaffed and we really overstrain to meet the needs for these patients.
The facility admits about 80 inpatients constantly and attends to over 200 outpatients weekly. Mental health issues are on the rise at the coast region due to increased drug abuse and depression occasioned by loss of jobs as a result of the COVID-19 pandemic. Port Reitz is the second largest mental health facility in the country after Mathari Teaching and Referral Hospital in Nairobi. Mathari was declared unfit for human habitation by the Mental Health Task Force that was commissioned by President Uhuru Kenyatta in 2019. The task force, in which Professor Lukoye Atwoli was a member, reported that the whole building is beyond repair and should be brought down and rebuilt afresh.
According to the law as it stands today, every public hospital that admits any patient for any illness is a mental hospital, according to the law. So if you walked to Kiambu, county hospital, that's a mental hospital, according to the law. So they should be able to provide mental health services there. Almost any health center should be able to provide basic primary mental health services and refer you to a higher level of care. There are a few specialized units across the country. So Mathari is the apex, is a top, which is supposed to provide super specialized services in mental health in this country. For a long time, there were a couple of others. There was Gilgil in Naivasha, where it was also a specialized mental health facility. Now it has been made a lot more general, so other conditions are also being handled there. And I understand that the county government has plans to try and spruce it up. But as part of the master plan for Mathari National Teaching and Referral Hospital, we are meant to establish satellite facilities across the country. So a facility like Gilgil is a prime facility where we can support so that people don't have to leave Nakuru County to come to Nairobi to get mental health services.
The other standalone facility in the country is Gilgil Mental Health Facility, which is located in Nakuru County. The facility serves the neighboring counties of Baringo, Kericho, Bomet, Narok, Nyandarua, Samburu, and Laikipia. The facility has for a long time been in a deplorable condition, understaffed and under-resourced. There, however, have been plans by the national government to upgrade the facility.
The biggest gap was financing. Services follow where the money is. So money is like the bridge that opens channels. And mental health has been poorly funded historically since independence, since before independence. At tiny proportion, I believe less than 1% of the Ministry of Health, yes, of the Ministry of Health budget is spent on mental health. So this is a problem. So first thing, if you commit to solve a problem, you must put money towards that problem. So we recommended an increase in funding, and the funding was to be targeted. So we recommended development of a mental health strategic plan, which was done. We recommended that specific areas need to be given emphasis, including suicide prevention, for instance, substance-related problems, for instance, and clinical services in the hospitals, but also primary mental health care, strengthening mental health in the community by funding mental health promotion, funding prevention of mental illness, and funding early diagnosis in the lower level facilities with creating a referral chain.
According to Professor Lukoye Atuoli, the cost of treating mental illnesses in Kenya varies depending on the severity of the condition and where you go for treatment.
There is a process ongoing in the Ministry of Health which is making the economic case for treatment of mental illness, which will determine those costs. So they are doing some survey to determine this. The cost of treatment ranges very widely depending on where you go and the severity of your illness. Now, if you have depression and it is mild to moderate depression, the cost of treatment can be very low because you might not even need medication. You might just need to go to a psychologist who will listen to you and give you tips on how you can handle some of the challenges you're encountering, and you'll be fine. So the cost might just be as much as going to Madari Hospital and speaking to a psychologist, which, you know, is not... Madari Hospital, if you don't have money, you don't pay. If you have NHIF, it will cover whatever costs are there for most of the conditions. I can't tell you the specific charges, so those will be, but it is probably the lowest that you can pay anywhere in this country.
Health workers here are also forced to take care of patients who are abandoned by their relatives. With high cost of modern drugs and facilities used in treating mental health conditions, coupled by lack of funding, their only option is the use of outdated drugs, which may be effective but with adverse effects.
Treatment. The treatment for mental health for real is very expensive. And when we prescribe the patients like second-generation drugs, most of them they cannot afford. So most of them they are depending on their families, like they are not employed, most of them, so they can't afford even for the medication. So you will find that we use old generation drugs, but we could give them the best drugs that really help them.
For a long time, research in medications for mental illness has not grown at the same pace as research for physical conditions, other medications, and so on. And so for a long time, the medications that are available for treatment of mental illness are medications that were discovered a long time ago, 30, 40, 50 years ago. But recently, you know, a bit of progress is being made in that area. So we have newer medications that handle the same conditions. What is spurring this research is the fact that, yes, so we know some of the things that change in the brain that make somebody behave in a certain way when they're mentally ill. So the medications that were discovered a long time ago are able to target those areas in the brain and calm them down so that the person comes back to normal. Unfortunately, they have a variety of side effects. And the side effects differ by medication and by the patient who's taking them. So it's not the same for everybody. And, you know, so the aim of research is to discover medications that have the same effect, but less and less of the undesirable side effects. So this is going on.
For counties in the North Rift region, that includes West Pokot, Elgeyo Marakwet, Baringo, Nandi, Uasin Gishu, Bungoma, and Trans Nzoia, the Moi Teaching and Referral Hospital has for a long time been serving as a treatment facility for mentally ill patients. There is some light at the end of the tunnel for men and women with severe mental health disorders after the first recovery home and skills center in Kenya was opened in September this year on the grounds of Moi Teaching and Referral Hospital in Eldoret.
The purpose of this home is to help patients who are suffering from mental health issues, one, to understand their illness. So we do something called illness management and recovery, where we teach them to understand their illness, where they should take their medication, and to also set goals for their life. You know, mental illness sometimes affects them in a way that they cannot plan for their own life. So that's one thing, illness management and recovery. And the second thing we do is to give them skills, where they can be able to develop skills like beadwork, tailoring, and any other skills. We are still building different types of skills, even computers, drawing, just so that they can be able to fend for themselves. So it's actually a home, it's not a ward. And when they're in here, they don't wear uniform like patients. It's voluntary, so they can also go when they home when they want to go away. They cook for themselves, they stay in a room, a bedroom. It's not a ward, we don't call them even cubicles, just a room. They go to the garden, they do exercises, so just like a home. And if you fall ill from here, we don't even give you medication from here, other than your usual medication that you should take at home. We actually take you to the hospital so that you can be seen. And we also invite families along the way to be able to come see what you're doing together, so that they know what you're planning and what you are experiencing. Because for some of them, maybe the problem was they couldn't shower, now they are showering. So we teach the relatives also how to support them, so that they can continue being able to participate in the activities of daily living.
Other community-based mental health initiatives that have recently been started by youth in the Coast region are run by youth who face a lot of challenges.
As a community-based organization, yes, when it comes to like psychiatric review and counseling therapy services, we offer them at a cost, but not that much. But you find that even if we have cut down that cost, still some people find it not that cost effective. So someone calls in, books an appointment, then when you tell them of the service charge, they won't show up. Only a few do show up. So that they as a community-based organization, we charge at a flat rate of 1,000 shillings, because we saw that that's a very considerable amount, because compared to like a private facility that offers psychiatric or counseling services, they charge possibly 3 times that or 2 times that.
We are not yet there, but I believe that we are making really bold steps towards a mentally healthy and appreciative society. People are working tirelessly to make sure that there are policies in place, for example. There are mental health work plans, for example, right now that are in place. Maybe what we will be looking forward to is really the implementation bit of those policies, the implementation bit of these kind of projects that enhance mental health literacy to young people in particular, and also to ensure that at least people have that safe places or safe spaces in their communities and among their peers who are informed on mental health to be able to improve their well-being.
Mental health conditions are not new here in Africa. It is not therefore a wonder that traditional and religious healers still play a major role in managing mental health issues. In fact, they are actually the first point of call for most families with relatives walking this path, despite their limited knowledge in these matters.
Societies organize themselves in particular ways since we started organizing ourselves as societies. And we create specialized, almost professions, if you like, traditionally. And before Western medicine, what we practice today came, there was medicine. There was still, people used to go and get help, people used to go and get treatment when they were unwell. So there was a theory of illness, even then. It's just that a lot of that was focused on physical illness. So if you broke a bone, there were people who would set your bones in our society. If you had fever, they would find some herbs and try and deal with that as well, and so on. So that was how they understood illness then. Mental illness was and still is very poorly understood. A lot of the manifestations of mental illness were attributed to other causes, like spirits, like curses, like an evil eye, or that you did something bad in the past and you're being punished for it. And based on that diagnosis, if you like, then the treatments were fashioned around that. So if it is a curse, then they would say there must be a way of going and, speaking to the spirits or the gods and taking the curse away. If it was something evil you did, then there was a ritual that you would be asked to do in order to get it away. Obviously, this was not going to work. If somebody has, severe depression, doesn't matter how many rituals you do, they need some kind of treatment. And so this would result in eventually people dying by suicide or things like that.
These traditional healers and spiritual leaders still exist in our society today, and according to Dr. Lukoye, mental health practitioners can and should involve them in modernized treatment to prevent such misdiagnoses.
Today, people in our communities will still take a person with mental illness either to a spiritual leader or to a traditional healer, because these are the people who are within their organized communities. These are the people whom folklore says can handle these kinds of problems. Our role is to get into those communities and have conversations with these traditional healers, with these spiritual leaders, so that they appreciate that there is a kind of person who's brought to them who probably would benefit from care in the hospital or in the organized health system. And this is the conversation that is taking place all over Africa, where the mental health providers are having conversations with the people who come into first contact with people with mental illness to say, well, there might be a category of people who are going through stresses of day-to-day life, who when they come to you, they can get helped. But there is another category of people who, no matter what you do, they will still require treatment in the hospital. We can help you to recognize those ones very early and channel them into the healthcare system so that they get help quickly and go back to being productive citizens instead of spending a lot of time in this setting where they're not getting assistance.
According to research, more than half of people with mental illness don't receive the help for their disorders. This is because more often than not, mentally ill patients are treated differently due to stigma. Sometimes they are mistreated by their family members and other members of their society. According to Dr. Lukoye, including everyone in discussions about mental health is the key to ending the stigma.
Most people with mental illness, which is not severe, and who are able to get themselves into care and are able to make decisions about their own care, they're treated just like any other patient. So you'll come in, you say, I'm not sleeping so well, or I'm having these problems. You'll be listened to, a diagnosis will be made, you will agree on a course of treatment. So that is the standard of care for most patients with mental illness. There are a few patients who will have very severe illness, illness that interferes with their ability to recognize that they are sick themselves and to recognize that they need treatment. So in that case, then we would need somebody, a next of kin, somebody who has the patient's best interest at heart to make those decisions for them. So in that case, then the doctor, the nurse, and so on would communicate with this person, explain what they think the problem is, and discuss the course of treatment for this patient. In the case of an emergency, and an emergency in this case refers to a situation where a patient's condition constitutes immediate harm. I mean, there's a risk of immediate harm to themselves or to other people around them. Then emergency measures have to be taken, and in that case, treatment can be given involuntarily until the person is stable, and then a conversation can be had. Especially sometimes if there's no next of kin around and so on, then the treatment will be given as an emergency in order to prevent harm to the patient or harm to other people around them, and then conversations can be had after that. This is being reinforced by policy, is being reinforced by law to ensure that as far as possible, a person with mental illness coming in for treatment is involved in the decisions around their care. And if they're not able, then the next of kin or a person who has their best interests at heart can then make those decisions on their behalf.
People with mental illnesses also have a role to play in their treatment and well-being.
People living with mental illness have a huge role in advocacy. They cannot leave advocacy to the mental health experts only. They can't leave all interventions to the government or the Ministry of Health. They are citizens as well. They have influence as citizens, and therefore they can advocate for more funding for mental health services. They can advocate for increased research in mental health. They can advocate for more training of specialists in mental health so that when they need these services, they have better access to them. People living with mental illness are not one homogeneous community. They run the entire spectrum. They're across this country. There are people in all positions. There are people in positions of leadership who are living with mental illness. I think they should take advantage of that. to speak out more about their own experience and to try, therefore, to influence the system to change in order to become more humane and to become more considerate to people living with mental illness. So I personally, in a lot of our initiatives, even here at the Aga Khan University, the Brain and Mind Institute, involves people with lived experience as part of the decision makers when we are planning our research, when we're planning our interventions and our programs.
According to the task force report, there are about 3,956 government-owned health facilities in Kenya, of which 284 are level 4 hospitals. Mental health care services are only provided in a paltry 29 of these level 4 hospitals, and patients have to pay for treatment and sometimes have no money to pay for emergency services, hence they are turned away. Mentally ill patients are human beings just like you and I. All they need is a holistic approach to treatment, and that includes medication, psychosocial support and therapy.
Mental health is
preserved wealth.
Chebet Birir at the Portrees Mental Facility in Mombasa County.
Hooray!